Hello, my name's Claire. I'm a member of the parent education team here at the Royal Surrey. We're going to start by talking about what to expect on St Catherine's ward. So St Catherine's ward is where you will come for the majority of your induction, certainly the early stages anyway. You'll be given an induction date and a time to come in. And when you come into the ward, you'll be assessed. So Caroline's already explained in the previous video how we assess the cervix using the Bishop's score. So you'll have a full set of observations, so we will monitor baby's heartbeat, we'll do your temperature, blood pressure and pulse, and we'll do that internal examination to assess the Bishop's score. If your Bishop's score is more than 6, then we do not need to do the softening and opening part of this process of induction. We can move straight on to the next stage, which midwife Natalie is going to talk to you about in a minute. If your Bishop's score is less than 6, we've got multiple different things that we can do in order to help that cervix soften and open so we can move on to the next steps of induction. St Catherine's ward is got 3 bays in it. You will be in a bay with other women that are being induced. So during the induction, you will usually be in this bedded bay with other women, but there is a chance, depending on your circumstances, how many weeks you are, why you're being induced and whether you've had a baby before, that we could do some of that induction of labour in your own home. That means you come in, you're assessed, you're given the medication or treatment, and then you go home for part of your induction. If you are with us for the whole time on St Catherine's ward, we'll talk about ways of helping yourself in a minute, because it can be a little bit boring and a little bit frustrating at times waiting around for things to happen. But we've got lots of people around to support you, and we've got lots of things that we can encourage you to do in order to make use of that time on the ward so it's not quite so boring for you. On St Catherine's ward, the birthing person can be supported by one birthing partner for their entire induction. However, if nothing is happening with you overnight, we'll be encouraging you to rest and relax and try and sleep in that overnight period. So if you aren't in labour, we'll be encouraging your birth partner to come home. But of course, if you were to then go into labour and require transfer to our delivery suite, our consultant-led unit, then of course your birth partner could come back in and support you. On St Catherine's ward as well, we have things like mindful colouring. So in order to sort of make use of your time, we have a mindful colouring box. It's a really good way of relaxing and giving yourself something to do during that induction. On the ward, you'll be cared for by maternity support workers, midwives and doctors, and we're all here to answer any questions that you might have about the process of induction of labour. While you're on the ward, what we encourage you to do is something called the 5 R's, both during induction and during labour. There's a copy of the 5 R's in your digital pack for you to read and print off, give to your birth partner so they know how to support you. The 5 R's are all about trying to encourage your good birthing hormones, oxytocin and endorphins, and trying to help you feel safe and comfortable during the process. So the 5 R's consist of, the first R is rest. We do not know how long your induction of labour is going to take. For some people, induction of labour is quite quick. For other people, it can take a couple of days. So it's really important during induction that you rest when you can. This is absolutely aided by bringing in your own pillows. So try and bring in pillows that make you feel comfortable, maybe an eye mask because the ward can be bright and a bit noisy at times. And if we're trying to get you to rest and sleep overnight, that can be a bit difficult. So you can bring in some earplugs and an eye mask and your own pillows if you like, and that will help you rest. The second R is relax. We just want to encourage you to relax in whatever way you can. So it might be mindful colouring that I've already mentioned, it might be watching films, it might be playing a game of cards with your birth partner, it might be listening to the relaxation audio that again is also available as part of this digital pack. Anything that you can do to help yourself relax during the process is going to be beneficial. The third R is reposition. So we have lots of things to help you reposition, to make yourself comfortable. The beds do all kinds of different things. You can ask the staff on the ward to show you how to adjust the beds, but we also have things like birthing balls available as well on the antenatal ward to help you position and find those comfortable positions to aid the induction of labour process, aid the baby's head to engage, etc., but also just to make you feel a bit more comfortable. The fourth R is rehydrate, refuel. So this means we're encouraging you to eat and drink little and often. So if you are consultant-led, just make sure, or diabetic, just make sure that your consultant has said it is okay for you to eat and drink during induction, but the vast majority of people it is okay to do that. Keep the food you're eating to be not really acidic or going to irritate your stomach lining or too fatty. So sort of foods that are going to give you energy, that you enjoy, and make sure that you're drinking fluids as well. So we do provide food for you. So you get your 3 meals a day as part of your induction of labour process. but it may be that you want to bring in snacks for you or for your birth partner. The fifth R is reassure. So this means at any point during your induction, if you need reassurance about what's happening and why, that you speak to a member of staff. You can either come out to the desk to talk to us or press the buzzer, and a member of staff will come and answer any questions that you have. Just a note, please do not bring any citrus into the ward because we have a member of staff with a severe allergy.